road to becoming a parent can, of course, be tumultuous. We've heard that this hour and leave many couples, specifically women, though, feeling insecure about their bodies. But my next guest says there are ways to take control of your maternal health, even as young as in your 20s. She's a reproductive endocrinologist and infertility specialist. She was recently featured in the documentary Stories We Tell, The Fertility Secret, which shed a light on infertility issues in minority communities. Please welcome Dr. Stephanie Thompson to the show. Dr. Thompson, thank you so much for joining us, because we wanted also to talk about the medicine and the emotion, right? Mm-hmm. Because so many of the couples today talked about the emotion and what they went through, but the medicine. One of the things I'm so confused about, the word infertility.
Yeah.
Because I read one place that said we shouldn't say infertility anymore, and then others still use it. So what is, first of all, why does it matter what we call it?
Right.
And what impact does that have?
So the term infertility is really part of the medical diagnosis. And what it really means is looking at the length of time you've been attempting to become pregnant. So for couples who are under the age of 35, they're considered infertile when they've been trying to conceive for 12 months. For couples who are over 35, if they've been trying to conceive for 6 months, they're considered infertile. And that's the time that you should actually seek treatment for infertility. Oh. And so that really encompasses the medical concept of it. We've shied away from the term infertility, though, when we're talking about the emotional part, right, and our fertility journey, because I think we want to convey more hope, and fertility gives us more hope, and there is a lot of hope in the field.
There is. I mean, when you think about it, we interviewed this hour Elizabeth Carr, the very first IVF baby. She's now 40 years old. The headlines back then, and I'm being transparent, basically described it as creating Frankenstein. Mm-hmm. People don't use that language anymore, but there's still a lot of misunderstanding about the journey. What do you think is the taboo you want to tackle most that people still believe?
Well, I think that people still believe that we are really trying to manipulate science, to create human life. And I think that there has been such advancement in the technology. And, we now really do have the opportunity to help people using the science that we know, that we should think about it more as really a medical treatment, more so than a creating Frankenstein. Just like we've made advances in cancer and other biology, we need to think about fertility in the same way.
Because it is a medical treatment, I'm still stunned by the fact that so much of it is not covered. The number of companies, big companies who have a lot of money, cover, we always hear the quip about they cover Viagra, but they won't cover other things. We're still hearing and seeing that. Why?
Oh, yeah. Access to care is a huge issue. And I think part of it is, one, there's just a general, in some ways you could say even disregard for women's health in general, right? And, as we become more advocates for ourselves, as we talk about it more, we don't hide the concept that we're going through fertility and fertility treatments. It's helpful for insurance companies and those people actually making policy to allow us to have greater access to care. And we're getting better. 14 out of 50 states in the United States have mandated fertility coverage.
Wow.
Yeah, and more states are going to come along board with that. And companies are now seeing fertility coverage as a competitive benefit.
Right. Now companies are saying, if I want to come to work for you, you're going to have to put this as a part of my benefit.
That's right.
Wow.
That's right. And I think, too, again, as our policymakers in Washington really start to see this, and a lot of them have been through fertility treatment. And as we talk about it, it's more commonplace. It'll make it easier for, again, those people who are in charge of the financial aspect to really help us. The technology is expensive. The medications are expensive. We know that. But that should not deny anybody the right to be able to have a child.
Doctor, you have a list of things, no matter the age of women, what we should be talking about honestly with ourselves. I want to start with 20s. What should women in their 20s be looking at this point?
So for women in their 20s, I think this is a good time just to start paying attention to your bodies, really, and just recognizing what may be normal for you and what's normal overall. A lot of things that we think are normal are not normal, right? Having very heavy cycles, not being able to go to work or school because of debilitating pain. Addressing some of these things now can help you with your future fertility. And, make sure that you're getting the care and the attention you need when it comes to these conditions, too. It's good to be an advocate for yourself.
I think that note about paying attention particularly to the cycle and not having this pain, because I have so many friends in their their 20s, they were like, I can't go. I'm debilitated by the cramping,
Yep.
and not realizing it was a sign of something later to come.
That's right.
That's very interesting. In the 30s, to be proactive about fertility, what do you need to do?
So this is a good time to do kind of a healthy lifestyle check-in, right? Things that we used to be able to do in our 20s, we can't do anymore. Stay up all night, eat the things that we want to do.
I'm kidding.
So in our 30s, good way to start optimizing your natural conception is by making sure that you're eating right? Kind of a low carbohydrate, plant-based, whole food
And
diet.
that all has a role in our
It does. It has
reproductive health.
absolutely in our reproductive hormones. Consider egg freezing, right?
What's the average cost of egg freezing?
Probably now about $10,000. And yeah, it's high, but that cost has come down dramatically, and I anticipate that it will continue to do so.
But insurance doesn't cover that.
A lot of insurances are starting to cover it as a benefit, yes. So large companies like Google and Amazon are covering egg freezing as a benefit.
Phenomenal.
Yeah,
All right.
it's
And
wonderful.
then once you're in your 40s, this is where it gets tricky.
This
I know
is where
that.
it gets hard, yeah, absolutely. So again, just doing a check-in and noticing different things about your menstrual cycle. Are they shorter, longer? These can be telltale signs of what's happening with fertility. See a fertility specialist sooner rather than later, somewhere between 3 to 6 months if you're having difficulty conceiving. And last, just be aware of the many options of family building. If natural conception, inseminations, IVF is not working for you, there are many other routes you can go. Elizabeth Carr hit it on the head when she said there are options. And we should know our options. And even if we don't go forward, we should have the conversation.
Well, you are brilliant, and I appreciate you. And before, I know we went through the age group. Before we wrap up, we're out of time. I do want the people who live in rural areas, who don't live in big cities, to know that I am also aware and hear you, because I live in New York City, and I've lived in big cities. A lot of these things are accessible, these specialists like yourself. And when you live in rural communities, you often feel forgotten. So that is a big part of the journey as well. And it's important for me, from being a Luling, Texas kid, for folks who live in areas that don't have wonderful doctors like yourself to know they are part of this conversation too.
Absolutely.
Dr. Thompson, thank you so much.
Thank you.
Thank you.